A very good morning, ladies and gentlemen. Thank you so much for spending your precious time with us today. My name is Asbullah and I'll be the moderator for today's forum. It is an absolute blessing to have such an outstanding panel today discussing the topic of how the pandemic affected our healthcare system. So, without wasting our time, I'd like to introduce our panel with us today. On my left is Dr. Cassandra, who works at Pantai Hospital Laguna Merbok. Beside her, the fine lady is Dr. Krisha, who works as an orthodontic surgeon in Sultan Abdul Halim Hospital, Sungai Petani. On my right is Datuk Kash, the Health Minister of Malaysia. The last but not least is Mr. Aryan, who works as a nurse in Metro Specialist Hospital. I hope everyone is doing well. So, without further ado, I would like to start our discussion on how the pandemic affected our healthcare system. First of all, let me briefly explain about the pandemic. Severe acute respiratory syndrome coronavirus 2, which is known as SARS-CoV-2, is the infectious agent responsible for the COVID-19 pandemic, which began in Wuhan, China in December 2019 and has since spread to more than 120 nations. As of November 15, 2020, there have been 53 million confirmed cases of COVID-19 worldwide, with 1,308,975 confirmed deaths. SARS-CoV-2 is a pathogenic virus that can spread quickly and is highly transmissible, and bats are thought to be its natural host. The virus mostly affects the lower respiratory tract and can cause severe pneumonia, which can lead to acute lung injury and acute respiratory distress syndrome, both of which can result in death and a high rate of morbidity and mortality. Currently, the primary intervention used to stop the spread of COVID-19 is physical distance, practicing good hand hygiene, and regularly cleaning high-touch surfaces with disinfectants. There have been numerous reports of symptoms ranging from mild to severe in people with COVID-19. 2 to 14 days after the virus is exposed, symptoms may appear. Anybody can experience symptoms of any severity: fever, cough, shortness of breath, fatigue, muscle or body aches, headache, new loss of taste and smell, sore throat, congestions, nausea and diarrhea are also potential symptoms. They aren't all the possible symptoms on this list. New COVID-19 variant may alter symptoms which can change depending on the vaccination status. Now I would like to ask our authorities, Dr. Krisha, to share your opinion on how the pandemic affected our healthcare system, mainly on what the risks that the dentists face. Welcome, Dr. Krisha.
Thank you, Mr. Hasbullah, for that kind introduction, and thank you for having me here today. Regarding the risks dentists face, well, dentists are one of the highest risk professions along with ENT and ophthalmology, as we're in very close contact with our patients. Dentists also perform procedures that generate aerosols. Aerosols are suspensions of tiny particles or droplets in the air. Dental handpieces, ultrasonic scalers, and air water syringes used in common dental practice all generate aerosols, which are usually a mix of air and water derived from the devices and patient saliva. So for instance, if there were a symptomatic patient who doesn't have symptoms but could be a carrier for the virus, this could put our team at very high risk if we don't have the correct PPE, personal protective equipment, because of the ability of aerosols to remain suspended in the air and travel further than splatters and splashes. Distant contamination may occur, and there are potential for disease transmission even after the person has left the vicinity, as the coronavirus can survive on such environmental surfaces for prolonged periods of time.
Thank you, Dr. Krisha, for that wonderful speech. I personally believe that after listening to your speech, people will start to realize that dentistry isn't an easy profession and they too are facing crisis as well. Dr. Krisha, could you please explain further on how this outbreak impacts the clinical activity, please?
Yes, so regarding the clinical activities, even though dental offices are already inherently clean since masks, gloves, and gowns have been standard issue for years, the coronavirus demands even higher standards of sanitation and caution for both staff and patients. Because of the inevitable droplets transmission during a dental procedure, which generates aerosol and increases the risk of infection in the time of a pandemic, extra precautions are taken at every dental clinic contrary to pre-pandemic stages. Most dental clinics prefer patients with an appointment and will only accept walk-ins with an emergency. As per the SOPs in the new normal, scanning of MySejahtera, temperature and travel histories of patients needs to be obliged. In the treatment rooms, all nurses and dentists are required to be equipped with the proper PPE and ensure a well-ventilated room, use of high-volume suction, and finally allow at least 20 minutes for thorough room disinfection before the next patient. Regarding the economic side, businesses were struggling during the pandemic since the magnitude of decline in working hours and net income had resulted in the decline of earnings. The COVID-19 pandemic had a major impact on the healthcare sector, as we all know, mainly due to the series of national lockdowns that had significant effect on thousands of jobs, including the dental industry, which was forced for closure for at least 2 months in the beginning of March 2020. All government and private dental clinics were advised to defer any elective treatment involving all non-emergency cases, such as restoration, orthodontic treatments, aesthetic treatments, extractions of asymptomatic teeth, and routine radiographs, with healthcare organizations recommending dentists to see emergency cases only to contain the spread of the virus.
Thank you again, Dr. Krisha. You maintained remarkable poise in the face of potentially hostile audience. Now let us listen to what Dr. Cassandra has to share from her perspective in the hospital. Welcome, Doctor.
Thank you, Mr. Hasbullah. I would first like to share on how the pandemic affected me and my fellow doctors from a physical point of view. As we all know, hospitals are facing an overflow of patients, especially in the first year of COVID. This required many of us to be in the hospital more to be able to tend to the overflowing amount of patients. This of course caused many of us to be in constant anxiety as we were still not sure about how high the mortality rates were and what sort of side effects that COVID would have left on us. We had to take extreme measures at the hospital by masking up, by wearing personal protective equipment, by also taking extreme sanitary measures in order to protect ourselves and also the people around us. It was very taxing for us tending to the massive crowds, and we were not able to get enough rest, which caused our physical health to deteriorate very quickly. Burnout started to be a common sight among doctors as we struggled to be there for our patients. On top of that, we were the ones being exposed to the virus the most, with only very basic protective measures. Eventually, most of our doctors contracted the virus. Unfortunately, we have also lost some of our best doctors, as contracting the virus while being immunocompromised due to such mental and physical stress can be lethal. Due to the shortage of health staff, I had to make the decision to be at the hospital more often. I was not able to be with my loved ones at home as much as I thought I could, and even when I was at home, I was fearful of passing on any sort of viruses onto them. The pandemic really put a strain on my relationships, but I'm grateful that it turned out okay in my case. Besides a shortage of medical professionals, we also were facing a rising shortage of ventilators, which were needed to care for critically ill patients. Such a shortage forced us to prioritize ventilators to people of higher risk of COVID. Equally alarming was the shortage in PPE, which included face shields, gloves, gowns, respirators, which we had to change often in order to avoid cross-contamination. However, the deterioration of mental health among doctors is what I believe to have affected us most during the pandemic. Due to the high volume of patients, it was no surprise that we were eventually short-staffed. I had to be at the hospital constantly tending to more patients. Every day I would have to watch my patients fight for their lives in agony and even witness some deaths in the ICU. In addition to that, we were also aware that there were people in the public who thought that the virus was a propaganda and did not take the graveness of the situation seriously. This, combined with our physical exhaustion, was what really took a toll on our mental health. As doctors, we want to do our best to save our patients, but we couldn't help but feel hopeless during this period. Many fellow doctors that I knew of spiraled into depression and insomnia, and the suicide rates of physicians increased during this period. I was very fortunate to have not spiraled into such events, and I'm very grateful that my colleagues were able to stick through such tough times.
Thank you for sharing your experience, Dr. Cassandra. We empathize with the situation you're going through. Some doctors can't even find the time to sleep, and so they end up sleeping in the hospital with their patients. As you have said earlier, doctors are really sacrificing a lot, such as spending time with their family, and even if they want to, they still have to be worried that they will pass any sort of virus to their family members. I still believe there are many forms on how the healthcare system is affected by the pandemic. Can we hear it from Datuk Kash, the Health Minister of Malaysia?
Thank you, Mr. Hasbullah. Before we start, let me take this moment to thank again all the frontliners who have put their life on the line just to aid the people in this country. They really are the superheroes of this nation. Well, getting to the topic of today, well, obviously the Health Ministry department was directly involved in this entire commotion. Our department had to handle problems that we had never seen before. One of the biggest problems we had ever faced was the people's perception about the vaccine. It was as if they already had a stigma around it. People started to assume that when they have taken the vaccine, they would definitely have side effects which may lead to death. This whole rumor started because there was a series of people passing right after having their vaccinations. But that is actually nothing and actually just a pure coincidence. Almost all the so-called victims already had other underlying diseases which just caused further complications to the body when having taken their vaccination. This caused a fermenting fear among the citizens, rendering them vulnerable to the disease and making them potential carriers who spread the pestilence. Another problem our department has to run into is the sharp rise in the anti-mask sentiments among the populace. In the minds of these individuals, face masks are not seen as a safety precaution, but instead are seen as a leash on their freedom, when in reality it's the opposite. Face masks have and still do provide an unprecedented amount of safety to an individual living in the times like today, and it is the responsibility of everyone for the sake of themselves and people around them. Despite this, the existence of the anti-mask meetings and rallies have swayed a good chunk of the public into believing these lies. Even if their intentions are good, pure, and born of ignorance, there is no mistaking the harm these individuals bring to the overall peace and safety of our society as a whole. There is also a whole different problem that arose during this phase relating to the doctor contract issue. This problem first emerged on a bigger scale when the pandemic hit us and when all the hospitals were at full capacity. At this point, as mentioned earlier by Dr. Cassandra, all the doctors were physically and mentally drained. So all these doctors who were under the contract felt as if they were not given the correct opportunity, and as their future was uncertain in the government sector. This caused the doctors to go on strikes and even protest. Some even went to the extent of terminating their contracts with us in the name of protest against the system. This took a huge toll out of our healthcare system as all these problems came pouring all at once. Well, these were the few main hurdles we faced, but we managed to it all. That is most of the problems that we faced throughout the pandemic. That's all from me. Thank you, Mr. Hasbullah.
Thank you, Dato. Now that was a very informative speech given by our Health Minister of Malaysia, Dato Kash. What you have mentioned above was 100% true, Dato, because there are a series of people who haven't taken vaccine yet. Neither they are influencing others as well as not to take vaccines by telling the disadvantages of taking vaccines. Hopefully now they will realize the importance of taking vaccines in order to prevent from COVID-19. Mr. Aryan, how do you think this pandemic has affected our healthcare system? Kindly do share with us.
Thank you, Mr. Hasbullah, for this opportunity today. Compared to doctors and other frontliners, the role of nurses in the fight against the pandemic has gone widely unnoticed. In spring of 2020, I left a hectic but beloved post-op unit for 4 days off and returned to what honestly felt like an apocalypse. Our unit was converted into COVID-19 unit since it was right above the emergency department. Patients could be taken to a room quickly and without having to be transported across the whole hospital. The entrance had a large red sign that read, "Do not enter, closed unit." The formerly loud and busy hallways were empty. The patient doors were closed with their own version of a bright red sign, and yellow storage cubbies hung over every door, packed full of personal protective equipment. We will all now be COVID-19 nurses. I remember the cold wave of fear rolling over my body and immediately calling my family and begging them not to leave the house. Just like the rest of the world, we were learning something new about the virus, treatment, and PPE nearly hourly in the beginning. There were multiple huddles and emails every day to keep the sub updated. At one point, I searched on the internet how to take care of a COVID patient simply because I had no idea what our patients would need from us. In the beginning, it was our oldest, most vulnerable patients who we took care of, but as the virus quickly spread throughout the community, those patients' demographics changed. We saw younger, seemingly healthy patients being overcome with hypoxia. We called countless family members and stayed at our patient's bedside with a tablet so final goodbyes could be said. When patients were discharged, we all lined up and clapped and cheered. These fleeting moments of joy soon became a highlight of our long days, weeks, and months. The patients had done it, they had beat COVID-19, but so had we. Every patient we sent home was a victory for us too. We all battled fear, exhaustion, and anxiety in a plastic gown with sweat running down our bodies and N95s rubbing our skin raw so we could make sure we were not taking the virus home to the ones we love. Outside of work, I was giving my friends and family frequent updates on how serious the virus was getting. But despite my fiercest warning, during Deepawali, my uncle, Mr. Muthu, went to a local hospital close to where he lives and was tested positive. 7 days later, just 2 short hours after Uncle Muthu texted me for the last time, his oxygen saturation rapidly plummeted. He was intubated and a chest tube was emergently placed. His caregivers soon lost his pulse. CPR was done for the next 2 hours. On December 6, 2020, my uncle died of the same virus I was tirelessly fighting every day at work. Mr. Muthu was a social man, always talking and engaging with anyone in his vicinity. I later learned how severely his time in the isolation affected him by reading all his doctor's notes which mentioned how lonely Mr. Muthu was. Ultimately, this is what continues to weigh on my heart. After this point, I went above and beyond to make sure I'm taking the time to give an update to family members. I answered every call, even called them before they called me. I called even if the patients could have made the call themselves. I found the time to give as much comfort as I could over the phone, which was all I had to offer. Throughout the pandemic, my manager continuously asked me if I needed a break from working on the COVID-19 unit. I always said no, that I would stay on my unit and see this out. And I did until 3 months after Mr. Muthu's passing. His daughter Shivarami, my cousin, also died of COVID-19. I had reached my personal limit. I had cared for these patients every day, and now my family was torn to shreds with grief. It was a kind of grief that keeps you up at night, helplessly thinking through the alternative endings or to the story. It was then that I finally took my manager up on her offer and take a break. Thank you, Mr. Hasbullah, for allowing me to give this talk.
Thank you for sharing your heartwarming COVID experience. We all know how arduous it is to be the part of the nation's frontliners. Let us just take a moment to commiserate with each other and appreciate our kindness and unrelenting effort in curbing this pandemic. I'm glad to be moderating this topic today, which is how the pandemic affected our healthcare system. It is something we all need to hear and learn from. Thank you once again, Dr. Cassandra, Dr. Krisha, Dr. Kash, and Mr. Aryan for sharing your experiences. May this COVID pandemic end sooner or later with the help of latest medical discoveries and communal effort of observing the rules. With that, I'll bring this to a close. Have a nice day, everyone. Thank you.